I started to realize a lot of things. I started to realize that networks in no way, shape, or form are a good thing. They're a guise for the monopoly. They're a guise to take away the power of the buyer, right? That I'm not even getting a better price. I'm paying far too much. But the power of the buyer is to walk away from a bad deal and go to a better deal. And if you're trapped in an insurance network, you can't do that. They don't even show you the price. I mean, the monopoly's gotten so powerful that I can't even, how can I shop if I can't see the price or can't choose from an array of choices? And so that was one of the big ones. And realizing that healthcare costs are probably 10 times on average, in Wisconsin maybe especially, but 10 times too much, that the root cause is that we're paying too much for healthcare, right? We can talk about a lot of different things and a lot of layers, but until we stop paying too much for healthcare services, this will never change. It won't matter if the government takes it over or tries to take it over, then the taxpayers go broke trying to afford 10 times too much.
Hey, welcome to Take Charge with HELPcare, Season 2. I'm Lee Aase, your host, along with Dan Hinmon, my co-host. And we're delighted today to welcome another repeat offender maybe from last time, Matt Ohrt, who is the Executive Director for the Free Market Medical Association. We're excited to have him be with us and talk again today about what he's doing, what he's seeing nationally in these trends in market-based, not just primary care, but healthcare overall. And so, Dan, I'd like to have you just kick off the interview.
Well, Matt, it's great to be here again with you today. We really appreciate you coming on the show. It's always great to co-host with Lee. So why don't we just start with a big picture question? You've spent about 25 years in HR leadership before becoming a national free market healthcare advocate. And so tell us about the moment when you realized that the traditional employer health plan model was broken and what you decided to do from there.
Yeah. Yeah, it's great to be with you guys. Certainly, I think we're going to have a fun discussion. I think a lot of people understand that it's really broken, but they don't have any idea why. And I was like that even after 15 plus years in HR. I think it was around 2016 that I realized that I was asked a question by the owner of my company. We're already self-funded but we're still seeing our costs go up 10% a year. And we've been absorbing that, but we don't know what to do about that. Can you help us? And that was like some kind of a interesting invitation to that led to me becoming passionate about a topic that I had almost no passion for. Probably like a lot of employers, it's like benefits, here we go again. Let's just get through this as fast as possible. What does our broker tell us to do? And we'll get back to business. And so then there were a lot of aha moments that happened after that, realizing that this actually was kind of part of our business. If you've heard my vacuum story and that I needed approval for a $350 vacuum and 2 hours to fill out a packet, but I had signed our stop loss that morning for 700 grand, pretty much on a whim, or at least on my own trust. And realizing that this is really the biggest overlooked part of employers' business, not just benefits or healthcare, but actually, is part of the business. So that's when I first realized it. And it's been the start and the spark of a second career for me now doing this.
So what were some of the things that you saw? What were the first 2 or 3 things that you saw right away that needed to be, implemented to make this work?
I started having a lot of conversations with a lot of even brokers who were, of course, trying to get the big account at Merrill Steel, which was 1,000 members. There's a big paycheck there for them, and I told them that, and I knew what they were doing, but they were also a free source of knowledge for me, right? So they were trying to get my account, and I never misled them. I said I'm not shopping for a broker right now, but it was just one discussion after another. Some of them would come every 3 months, right? And I guess I normally wouldn't do that, but they were a way for me to expand and speed up a learning curve that I that I needed. And so through those discussions, I started to realize things. I started to realize a lot of things. I started to realize that networks in no way, shape, or form are a good thing. They're a guise for the monopoly. They're a guise to take away the power of the buyer, right? That I'm not even getting a better price. I'm paying far too much. But the power of the buyer is to walk away from a bad deal and go to a better deal. And if you're trapped in an insurance network, you can't do that. They don't even show you the price. I mean, the monopoly's gotten so powerful that I can't even, how can I shop if I can't see the price or can't choose from an array of choices? And so that was one of the big ones. And realizing that healthcare costs are probably 10 times on average, in Wisconsin maybe especially, but 10 times too much. That the root cause is that we're paying too much for healthcare, right? We can talk about a lot of different things on a lot of layers, but until we stop paying too much for healthcare services, this will never change. It won't matter if the government takes it over or tries to take it over, then the taxpayers go broke trying to afford 10 times too much. So until we get to the actual fair costs, right, whether it's the free market or whatever the future is for America, I hope it's a free market. I actually feel like we're gaining major ground there. And yeah, so that's the free market is powerful if allowed to work. And that's what we're tapping into right now.
I've seen you say some things online about that, the system itself is not reformable. The healthcare system that we have, that something parallel needs to happen. So maybe talk a little bit about that.
It's actually step one. So we have a 4-step. This sounds oversimplified, so bear with me, but 4 steps to a free market. Imagine how simple is that?
Yeah.
Now they're really hard to carry out. They're really easy to understand, but I see a lot of well-intended people working in healthcare today in reforming and right policy and compliance, all sorts of things, fiduciary things, all sorts of things. I've come to the conclusion, and we at the FMMA have come to the conclusion that it is no longer reformable, if you will. Reformable as in all the current monopolistic powers to change their ways. And when you start to understand that there is a monopoly at hand, now technically it's an oligopoly. People would look at me funny if I use that word, probably the same concepts. It just means there's a few that are
There's just a
corroborating.
few of them instead of one.
You still have no power buyer, whether it's one or several. But when you recognize that they're doing really well, and when you recognize the buyers are getting run over by a truck, you realize that there's no motivation. Not only is there no motivation for them to reform or fix this, it's not broken for them, as many have said, right? It's working as designed. But they're resisting any attempts to make this affordable and reasonable. So you have a group at hand. It's kind of like the end of the Monopoly game, right? Where you ever play? Now we're us three are old enough to play that game. The kids
Play the
probably,
old
I don't know if
fashioned.
the kids are playing that game, but it's like looking at the person at the end of the game that's winning. Everyone else is like scraping and borrowing money and please, I hope I don't land on the railroad. I got to get past the go and get another measly $200. But everyone's suffering and going broke. And there's one person that is just winning with like no mercy, right? And so that's kind of where we are. I think where we are today, we're at the end of this monopoly game where it's either going to crash in some way. And many American families already are crashing. And actually, I had a little quote, but I'm going to give Grace a plug. This book just came out a few days ago. I don't know if you've seen this.
I hadn't seen
But
it. No.
Grace is the FMMA leader, the co-leader for Florida. And I sent her a quote. She asked me for a recommendation. And right there,
Okay.
so you open the book, and this is kind of fitting for what we're talking about. Here's what I said in 2 very short sentences. In today's healthcare environment, the 2 most frustrated parties are the physician and the patient, the only 2 entities that are required for a healthcare transaction. Dr. Grace Torres Hodges opens a door that has been quietly and surreptitiously shut over the past few decades, namely a physician's awareness and choice to enter independent practice. Right. So this has slowly faded away. And so just as DPC is, just as direct specialty care physicians are now realizing that I'm not really liking this game. I'm really not liking that I have 2,500 patients, or I'm not allowed to practice in a way that motivated me to go to med school. And so is there a path for me? And then they learn about the FMMA and they learn about all these successful physicians doing it, and more are doing it every day.
You said there are 4 steps to a free market,
Yeah.
right?
Yeah, we have 4 steps. So that first one, I'll kind of finish my thought there, but it's to
Mhm.
acknowledge that there's a monopoly. and to stop trying to fix it. That you can spend one lifetime, or I would argue 5 lifetimes, trying to fix that. But how are you going to fix something from the outside? It'd be like saying, pick a company and they're not running well. Lee and Dan, go fix that. Go fix that company. Well, I don't even work there. I don't care. Go fix it. It's impossible. It's impossible. So, and it's even odder in the case of healthcare is they don't want to be fixed. They're winning big time. The second step is that we're building out DPC is the foundation of this movement. And we believe that for 3 reasons really fast. It's robust. It can't be stopped. It can work with one person, a family, a small employer, big employer, fully insured, self-funded. DPC is exploding. We had 12 when I first in 2016. We had 12 DPCs in the state. We have 160 in Wisconsin today. But as the FMMA, we've mapped out the DPCs nationally. We're about to release a list of 4,300 DPCs. The other 2 reasons it's the foundation is that it's the funnel. Just like the hospitals use it as the funnel, the collector. We do too, but in a better way. And we're actually giving them good primary care. And then it's also the referrer, the most expensive thing. And one of the most expensive things in healthcare is the primary care doctor's pen. So that where that referral happens really matters for the health plan. That's where most of the dollars are. So that's step 2. And I would say we're really almost there. We're about to start on 3 and 4. When we release that, that's going to rocket fuel boost this movement. Step 3 and 4 are the specialty care side, which are much more vulnerable. We're going to map that out and grow that. We didn't have any surgery centers in Wisconsin that were independent, or at least that were giving great prices way back when I started. Today, we've got like 5. Right? We've got a couple of the nationally renowned cash pay ones, Renovo Health and Solstice Health. And new ones started in Western Wisconsin and so forth. And even a bone and joint locally started bundling and posting their cash prices 20 minutes from my house. I didn't even believe him at first. He's like, yeah, we want to meet with you for breakfast. We want to join the FMMA. And I'm thinking they're just playing games, but there is stuff happening everywhere. And then the fourth of that, which the 3 and 4 go together, are the employers getting in the game. Guess what? The buyers need to get in this game. And that's probably the hardest part ironically, is to get the large employers. Now, small employers will change tomorrow. They get it. They understand free market, and they understand they're going broke, and they understand these prices aren't reasonable. Large employers are still in the dark a little bit and still walking on this very broken path. So we'll see how that goes. But those are the 4 steps.
I love how you named DPC as the foundation, right? And and so how does, for instance, HELPcare help that whole process work in your view?
How does DPC?
Mm-hmm.
Yeah.
Yeah, healthcare clinic as
healthcare.
The
There you go.
example of a
Yeah.
primary care practice, a direct primary care
I
practice.
said healthcare. Yeah, healthcare. Yeah. So the name of your DPC, right? And so
Yeah.
you're growing, right? I think most of the DPCs are growing. It gives us that foothold to springboard off of. That if you don't have that, this movement dies. But this movement isn't dying. And so what's interesting too is small employers or families, some people, if they can't afford, right, they can't afford some of these plans or whatever, DPC can work by itself. Now, is there a gap there a little bit? Sure, there's a gap with the catastrophic. But still, that's 80 to 90% of your coverage. And then we have the health shares. I'm going to start getting into health shares big time here. And there are some other different style of plans, but the health shares fill that catastrophic gap really nicely. So DPCs out there, if you're not connected with health shares, look me up, or you can even become an affiliate and even offer those health shares to your patients.
Yeah, we actually had worked with some of those, and one in particular, Zion Health Share, has had a good program where they really want to provide incentives for members of their plan to use direct primary care because they recognize that this is going to be the way to, avoid those bigger claims that are going to need to be those bills that need to be shared.
And those health shares do pay, and there's a lot of misunderstandings and a lot of actually wrongful information being sent out by this 99% of big house brokers and things will say that they're not working, and they are working very well. They're just they don't have the 7-figure checks to these big broker houses so they're affordable and for a reason, not all the middlemen with their hands in the cookie jar. But there are a few health shares that even apply to employer plans, right, that don't require a faith statement. A lot of them have faith roots, but don't require. So Zion and Sedera probably being the top couple of those. And there's probably 3 or 4 or 5. And then there's many others that are there as well that are very large. I don't know if we have a perfect way to count, but it's my understanding based on research, there's over 2 million Americans on health shares today.
Yeah.
So I think that's, and then growing rapidly.
Yeah, and what you said about DPC being scalable and available for people at every point is, I think, exactly right. We've got about 40% of our members at HELPcare Clinic are retail. They're individuals and families who just say, "Hey, my deductible's too huge. I just want to get someplace where I can know that I can get the care, and I'll take part of what would otherwise be my deductible and I'll put it down there, and hopefully I'm not going to need other care besides that." But then we get the small employers who just say, "I can't afford insurance. I can't afford like that whole thing. It's just way too much, but I can maybe pair it with a health share, or at least I can give the 90% of the care that most people are going to need for maybe 10%, 10 to 15% of what the cost of the full insurance would be." And then, of course, the employers are coming, the bigger employers who are mandated to provide insurance are starting to recognize that, yeah, this 10% annual increase that you were talking about, that you were experiencing at Merrill Steel, that's just not sustainable. And so they're looking for something different. And it's been really exciting to be able to help show some different ways they can do it.
Yeah, and you guys are probably hearing right, but 10% now is if your MLR is at 60% or something, you're going to get a 20 or 30. I mean, the wheels are really falling off here. So I think these solutions are becoming much more viable. And there's still a lot of areas, one of the area I put out this book. You can see it on the right, this right here behind me. But this DPC for You and Me book, Good Care Feels Different. That's a 10-minute educational read. But one of the problems I would say, and here's a challenge for all DPCs, or here's a challenge for all in this movement. What percentage of people know about, when you say DPC or the phrase direct primary care, what percentage of people know what that is? What percentage of Americans? I would say 10%, as they say, right? 76.2% of stats are made up on the spot. So I just made up one. My guess is 10%. That needs to be 90. For us to know that we've had a successful cultural change, an unconscious norm, or a new way of doing things that we don't even think about, is that there's a new norm. And the new norm needs to be DPC and health shares and other things too, strategic self-funded health plans. But yet still most of the population doesn't know what DPC is, and that's a problem. That's what we have to change.
So what's your new role with the Free Market Medical Association? That's where we actually kind of met through that group when I attended their conference in Oklahoma City a couple of years ago. You sort of got me into this role with Minnesota, with the Minnesota chapter lead or co-lead.
Yeah.
So, you've had a long experience or long relationship with FMMA. And so tell us a little bit about that and how that evolved into this new role that you have, and what does that mean?
Yeah. I joined as a member when I was still in the employer's shoes in 18. Then I became a chapter leader in something like 21 in Wisconsin, and we started leading that movement. And of course, I had a story out there. People in Wisconsin heard about my story, so that gave me an advantage in roaming about the state and preaching this good news. And then late last summer, I got a message from Jay Kempton, one of the co-founders, to talk about this. And they've, just based on the work I've done in Wisconsin and with the book and speaking and so forth, they asked me to be the director. And so he's like, "Do you think that's something you'd be interested in?" I'm like, "Oh my goodness, like it's like my perfect role, right? Like I am
Mhm.
passionate about teaching and educating and traveling around and different things." And so Lee, by the way, I don't remember how the first time we met, but Lee is an incredible speaker. If you ever need a good speaker, this guy is good on stage. He's really articulate and really interesting.
Shucks.
So yeah, yeah, shucks. But yeah, and I don't remember how we met, but I remember I saw you speak, and I'm like, wow. So yeah, a great leader from Minnesota, and it's right. It's just regular folks like us. I'm just a farm boy from Iowa. Somebody who cares and somebody who realizes that if we wait around for everyone else to fix this, nothing's going to happen. So we might as well jump in. We're all getting older by the day. So thank you for all you've done in Minnesota.
Yeah. It's maybe backtracking a little bit, but I think one of the things for people who haven't heard your previous story, with Merrill Steel and just the results that you got there, I think if you go through a little bit of that to show how this is really makes a long-term difference in the future of a company to go to a plan like this.
Yeah. Yeah. We were, as I said, I joined Merrill Steel in 16 on already self-funded, right? So there's all these misunderstandings about self-funded. Well, that's a great start and that gives you flexibility, but self-funding without a strategy is pretty much worthless, right? If you're not controlling that root cause, which I mentioned. So I started looking into this. I didn't know hardly anything like I knew today. We started with one step, which happened to be DPC. And in my head, I was like, and we found a local DPC that they were trying to sell to the public and it wasn't going so well. And we were their first employer. 5 years later, they'd have close to 40 employers based on this kind of knowledge that got out. But on a $5.5 million spend, we started. So we implemented the DPC. We even remodeled and did it on site, which is not necessary by any means. There's near site or on site. Both are very similar, but we chose that route. So we got it in place. We started leading it well. We started leading it internally. We gained so much excitement that the employees actually said, "Can we start this early? We don't want to wait for the construction. Can we start like in a conference room or something?" And I said, let me talk with them, and we're okay with that as long as you don't come back later and say this was unprofessional if I'm trying to write. And then nobody did that. And so we said, we can't maybe do everything, but we can do certain things. And so we started early based on their request. We had kind of that anticipation and excitement. And I was expecting to go a year and ask the question, how did it go? Because it's not that we were the first, but we were one of the first, right? Briggs and Stratton way back. There's some old school stories that, but nothing that ever took off. And so we got in the CFO. It's amazing how time flies. The CFO who's passed now, who had retired when I was still there, but he came into my office after the first quarter closed after 5 months. And he said, "Matt, we had invested 250,000 in that construction side of things. We've already got that back and then some. The owners would like you to really spend more time on this." And they kind of had the green light. And there was 2 brothers and a sister. And the sister who was sitting next to me, I had owner support. That's one of the unknown things. If you don't have that in a company, good luck. I was still putting my neck on the line, and that sister has passed. Like, my goodness. But she was second generation, getting ready to retire, in fact, when we met. But she was a great support. Her name was Kieran Rejek. And we took off on this path. And then the next step, the DPC actually contributed. We had many partners and so forth, but they said, what about MRIs? What if we could have that truck that drives around the state and it's this big semi? That's where they go to the hospitals and they go to all the hospital clinics. You see it everywhere. It says MRI scanner on it. The driver is the tech. And so we said, he reached out to them and said, would they come here? I said, well, yeah, we'd have to put in a plug, which then I had to put on my old construction hat. I had a construction business back in school and 7 years in college. We spent 14 grand running the electric and building this board and so forth. And we got it in and we realized, we said, okay, how much if that truck comes here? And it was $600. But then we realized, wow, what's the bill if that truck plugs in at a hospital clinic? It was around 6,000. Like, wow. All right. That's a lot of money going in pockets, right? So we just want the 600 part. We don't want the 5,400 part. And so we did that and it paid for itself in a couple months. And then from there, we met a local PT who I still keep in touch with. And he was on site a couple days a week and had an office down the road. And we offered no cost physical therapy as long as you had the right connections and go through the DPC first and so forth. And we just kept going. We offered free chiropractic and then we got in. That's when I met Keith Smith, I think a couple of years later. And we started sending hip replacements to Oklahoma. People said, oh, they won't go. I said, they're going to Oklahoma for hip replacement because we would even incentivize it. If we could get a hip replacement for 15 grand at the time, when we pay 60 to 80 to 100 plus in Wisconsin, do you think we could afford some travel costs? Sure, we could. So the plan was winning this year's claims or next year's premiums, when the plan was winning, the members were winning because they were either getting free care or incentivized care. Getting them $2,500 to go to Oklahoma in their pocket. That was taxed income plus all their expenses. So the healthcare was so broken that we could afford to give them this kind of money or these kind of breaks and still come out ahead. So there's lots more to that story. We changed every partner within the plan. That was not easy. The DPC was the only original partner that stayed. I ended up going through the rigors of changing TPA and PBM and networks and so forth. So that was quite a journey. And we did it out of order, but we weren't afraid to try. And I would do it differently today, but it was still successful.
So TPAs and PBMs and all these other 3-letter acronyms that you hear through the system. We're going to have a chance for people in our part of Minnesota to learn about that. Employers, particularly, CFOs, CEOs, HR leaders, to come to an event that we're holding on August 5th called Building a Better employer health plan. That's the name of the program.
Mhm.
That's going to be at the Haley Comfort Systems in the upstairs seminar room, and so you're going to be the keynoter. You're bringing it home that day. So we will have a PBM or pharmacy benefit manager. We'll have a physical therapy provider that also is interested in this direct contracting with employers. What do you think people can expect, or what do you think they should be coming away with when they come spend the afternoon with us on August 5th?
One of the things I see nationally, I'm still speaking quite a bit monthly in different states. And I think people think that, well, I don't know anything about benefits, or I don't understand all that. And that's probably true because it is complex. But what's interesting about this movement and about what we're doing with employer health plans and with direct care is that it's actually quite intuitive. When you connect with a CFO or a CEO, you say, we're just shopping for health care. This is a big mistake, right? People say, I wanna buy health insurance. No, you want to buy health care. You might need health insurance or some sort of coverage, right? But we started buying health care, not insurance. And by the way, we already have these skills. Employers have these skills. Individuals have these skills. Do you walk into a grocery store and not look at the prices, or go buy a flat screen TV or a car and not comparative shop? Sure, sure you don't. You do every time, right? So these are skills that Americans have, and all we're doing is applying those skills. So I think people find it's like, wow, I get that. I actually get that. I don't get all this health insurance game that still confuses me, but I get that I can spend 600 for an MRI when instead of 6,000, and I get that I can shop around for quality, and I get that this health plan, if we don't control the costs behind or after the deductible, right? We need the members to care about more than just their $3,000 or $5,000 deductible. We need them to care about the full price. That's one of the tricks, because that's what makes the premiums go up. So we're just farm boy that really just kind of dug in and wasn't afraid to stick. Back then it was kind of more dangerous. I've talked to some peers like me. There are 5 or 6 in Wisconsin, which is really high. And every one of them was like, "Yeah, I put my neck on the stump." You go today, and they're actually all successful. They all had great rewards from it. Today, it's not like that. We know the way. Almost all of this path and trail has been blazed, and it's really just about finding the people that know how to do it. And then utilizing direct care and yeah. So I think this part isn't complex. I would say old insurance is still complex, but this part is very understandable.
Yeah. Well, I just want to thank you for doing that trailblazing, because I think when we first connected, it was when you were working in a previous role, and you had an employer that had some employees in the Rochester area, and you're sort of checking out what we had to offer as a direct primary care clinic that could be part of that plan. But just the fact that what you've done is helped us to put together some of these bigger employer groups that really then gives the wind beneath our wings, so to speak, that puts the wind in the sails, that it's a lot easier if you sign up a larger group versus signing up the retail individuals one by one. So it's like, this is where, the employers pay a good chunk, the majority of health insurance and health care costs, in the country. And so if that's where the money's already being spent, having a way to connect and build this direct primary care experience into that plan, it's been folks like you have made just a huge difference for us in being able to do that.
Well, thank you. Thank you. I think we all want to win, right? It's no fun to get out of bed and say, I'm going to go play a game today and lose. That's not very inspirational. So, but I think healthcare has gotten to the point where it's so broken that almost any initiatives you do you're going to gain something. You're going to lower cost and improve the care. And it's for those with the courage. And we say, with FMMA, right? This isn't for everyone. If you're a fraidy cat, I'm going to pick on some people, right? But if you're a fraidy cat, or if you're scared of change, then you can follow the old path. I'm going to be almost a little sarcastic here, right? But if you're frustrated like most folks, and you have the courage to do this, come along with us. Come join us. Come join the Minnesota chapter of the FMMA. Come to the national conference. You're going to meet a lot of people. People sometimes across the nation, they think they're alone, right? They're like, I thought I was alone. They come to the conference, and there's like 1,000 people feeling just like me: physicians, advisors, employers, many others. And so you're not alone. You're just still probably the minority, but come join us and watch what happens. So those with courage. If you don't have courage, stay home. But if you're ready to make a change, come join us.
Yeah. So we'd invite some of those courageous employers from Southern Minnesota, and as well as other practitioners who are interested in learning about this model, to join with us on August 5th and get to meet Matt and as well as the other speakers that we have. Thanks for joining us. Thanks for your leadership first, but thanks for joining us for this today and for that event on August 5th. And we look forward to continuing to work together.
Yeah. Thanks to you guys as well and all who are active in this. So we can be part of the problem or part of the solution. I choose the latter.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the healthcare clinic difference at helpcare.health.